if you're having a white discharge or a yellow discharge, but probably a white and a gray discharge, accompanied with no smell, but most importantly with some very severe itching in your genitals, then probably you have something known as a yeast infection or candidiasis, vaginal candidiasis. I think I've said that correctly. Yeast infections or vaginal candidiasis is usually caused by a fungus known as Candida albicans. One important thing to know is that this fungus is usually found at different parts of your body, in your mouth, in your vagina, and it is a fungi or a microorganism we classify as normal flora. In normal populations in your vagina, this fungi never causes any problem. However, the problem only arises when the populations of these fungi tend to increase rapidly in your vagina. Now, if you have noticed, you might be having this discharge probably after using some certain medication, and it's true. Using broad-spectrum antibiotics usually causes this problem because the broad-spectrum antibiotics will usually kill the normal, the good bacteria in your vagina, mostly the lactobacillus bacteria. And by killing the bacteria, they create room for these specific fungus to grow very rapidly in the vagina and cause this problem. In addition to that, you might be having issues with your periods. Now, this is very common for some ladies. You might just have had your periods or are about to have your periods. Suddenly, you are having a discharge and you are having some very severe itching. Now, this is usually because of certain differences in your hormones. Mostly estrogen is the culprit, as well as progesterone. But as well, you might be having issues with sanitization. So definitely, if you have some very poor sanitization, you'd probably develop this problem. Now, there is also another thing that can bring about this problem. It is a controversial thing, but I think it is important for me to mention here. The issue of oral, oral can as well cause this problem in some people. And the reason to that is that some persons usually have this fungus in their mouth. And they can introduce variants of this fungus into your vagina, and that can cause some severe problems. You might as well be pregnant. So if you are pregnant, for some women, they might develop yeast infections, especially during their third and fourth months of their pregnancy. So that is usually quite common, and as well is usually caused by issues with the pregnancy hormones in some women. The difference between yeast infection and bacterial vaginosis or bacterial infection is that for a bacterial infection, you'll have a discharge. It can be white, it can be yellow, it can be brown. But one important thing is that the discharge usually has a very bad or a terrible smell. So that is something you have to note with that. However, for a yeast infection, you'll have a discharge, and the discharge might be curdly in appearance. It appears like curdled milk. And the discharge might not really have any bad smell. It might have a smell, but the smell tends to be more of baked bread or cheese, etc. So it is not really a bad smell, but most importantly, you'll have some very severe itching, and the itching usually appears as soon as you start itching. That spot usually swells. Then after some time, the swelling will disappear. So if you are having these symptoms I'm talking about, then probably you're having a yeast infection. There are a wide variety of things you can do if you are having this problem. The first one you have to do is always ensure proper sanitization. Ensure you clean yourself properly. You should not do something known as douching. So some people usually do douching. I'd advise against doing that. Douching can as well worsen the problem. As well, don't use normal water to wash inside your vagina. That can also worsen this problem. Most importantly, I'd advise visit your gynecologist or a hospital or a medical practitioner who will be able to examine you and give the most suitable treatment to you, because just as I've said, yeast infection is usually an indication of something that is underlying. So you develop a yeast infection because of something. So as soon as we identify the cause of this yeast infection, it is much easier for you to treat your yeast infection and it will disappear immediately. There are a variety of drugs that are on the market right now that can be used to treat the yeast infections. The most common ones are clotrimazole cream. Actually, the azole class of antifungals are usually used for this purpose. But as I've said, it is important you visit your gynecologist or a health practitioner so that you can identify the root cause that is bringing about this yeast infection. If it is maybe you're using drugs, maybe antibiotics that are causing the problem, we can be able to change the antibiotics to maybe narrow spectrum antibiotics. If it is something to do with your food, because some people are allergic to certain foods and it can cause serious problems to them. Yeah, so if you are allergic to food, you can be able to adjust that. One important point of advice, if you're having a yeast infection, this comes to the food aspect of what most people consume. If you're having a yeast infection, consider chewing on garlic. Garlic usually helps very much. Garlic is an antifungal, if you didn't know. You can take a clove of garlic and consume daily. It can help, yeah. But most importantly, try and consume probiotics, as I'd said in one of my videos. If you can get normal yogurt, it can really help, because yogurt usually contains much of these normal bacteria, especially lactobacillus that is found in our vagina, so that can be able to help resolve the problem. I think I'll be doing a video about basic remedies that have worked for very many people that have come across for yeast infection. So stay tuned for that. I'll do a video and upload it on this channel. If you're new to this channel, kindly consider hitting the subscribe button, enabling the notification bell. If you'd like to see more of these videos as well, consider doing that. Thank you guys for watching this video, and I hope to meet you in the next video.